Hello, my name is Dr. Christian Augustin and I'm with Bayside Chiropractic and Rehab in Fairhope, Alabama. And today we wanted to take a look at shoulder pain. Now the first thing we need to talk about with the shoulder is a very complex joint. It has actually three different bony joints, which are the AC joint, where the clavicle and part of the shoulder blade meets. Then we have the glenohumeral joint, where the humerus meets with the glenoid with the shoulder blade. And then we have the sternoclavicular joint, which is where the clavicle meets with the sternum. So you got three bony joints, and then on the back you have a non-bony joint, a muscular joint, where the shoulder blade meets with the back of the ribs, or your upper ribs, and that's held together by muscles. So, you know, a lot of people throw out a lot of things like rotator cuff tear and frozen shoulder and bursitis and impingement syndrome, and the list goes on and on and on. But what we need to know with the shoulders first, is it really the shoulder or is it really your neck? Most people have upper arm pain. Some it'll actually go below the elbow when it's shoulder. It can, depending how severe it is. But a quick test to differentiate usually between shoulder and neck is, can you do a simple motion? Now it might be a little painful, but can you put your arm here? And can you put your arm behind your back like this? With or without the pain being in your upper arm. If you can do those motions, there is a good chance that that arm pain going down that upper arm and forearm pain going down your arm is actually coming from your neck, and there might be nothing wrong with your shoulder, even though it hurts. So that's one quick test. Now it doesn't work 100% of the time, but it wouldn't hurt you to try it. The next thing we have to deal with is, why do we usually get shoulder problems? Most of them don't happen because we get in some wreck or we have a bad accident. Most of them happen because of repetitive trauma, like baseball players, golfers, those kind of things where you're doing it constantly, working the shoulder. And the second group happen if we do a motion that's constant, or we do something for too long, or we don't get enough motion. Painters have a lot of shoulder problems because they always hold their arm above their head, which cuts off some blood supply to the shoulder and can cause a lot of problems. So those are the two main reasons. So think overuse and underuse. Now, one interesting point with the shoulders, a lot of people say, I got bursitis. I got bursitis. Well, the interesting thing with bursitis is, and the common, what they'll usually have done is they'll have a steroid injection put into it, and it feels better. Here's the problem though. The bursitis usually didn't come there on its own. Something had to change first to cause the bursitis. All the bursa, which gets inflamed, is just basically a balloon filled with fluid that protects your muscle from rubbing against your bone in your shoulder. So you have a main bursa right here, and you got a lot of other ones, but a main bursa that kind of sits right here. And what it does, it protects all the muscles from rubbing against the bone, so you don't get muscle damage. Well, for that to get inflamed, that means you have probably some kind of motion in your shoulder that isn't right. And if you don't correct the improper motion or the lack of motion in the shoulder, the bursitis keeps coming back. So you're really just putting a Band-Aid on a symptom. Which, yes, bursitis can be very painful, and sometimes that Band-Aid feels really good, but you have to also look at why you're getting the bursitis. Now, most shoulder problems, apart from real traumatic ones like complete tears in the rotator cuff and stuff, can be treated by restoring motion in the shoulder. Our shoulder is a unique joint, much like our hip. It's mainly held together by all muscles. especially the main part of the shoulder, which is the glenohumeral joint. So when something's wrong and we can't move our shoulder right, we start getting things like decreased range of motion in your shoulder. You can't lift your arm all the way up. You can't rotate it. So the main therapy that helps the shoulder is to get the motion back, which makes chiropractic really good because that's what we focus on. We also focus on some pain relief and decreased inflammation, but be very careful with trying to diagnose a shoulder versus a neck. You should seek professional help with that, because you could miss a neck, a herniated disc, thinking it's the shoulder, or you could think it's a neck and it be a shoulder. So you should get checked out. Now, if you're interested in finding out more, I'd be more than happy to talk to you and do an evaluation. And again, my name is Christian Augustin. You can reach us at Bayside Chiropractic and Rehab. My number is 251-990-8388. I look forward to hearing from you. Thank you.